Hello, my name is Autumn Carter and I'm a nurse practitioner student at Claflin University. Today I'll be performing a respiratory or pulmonary examination. My patient here, he's given me consent. I've washed my hands and now I'm going to use some Dermex. Alrighty, I'll start the examination by inspection. So at first I'm just going to be observing his respirations, looking at the rate, the rhythm, and the depth of his breathing. I'm going to be looking at his color, assessing for any audible wheezing, use of accessory muscles, and I'm just looking at his trachea to make sure that that is midline. Alrighty, now I'm going to get you to take a deep breath for me. Okay, upon doing that, I would just inspect his thorax, looking anterior and posterior and lateral of the chest. I'm looking for any skin abnormalities, looking at his skin characteristics, assessing for symmetry of breathing and the shape while asking him to take that deep breath. Alrighty, so now I'm just going to palpate anterior, posterior, and lateral of the chest wall for any tenderness. I'm going to start posterior. Any tenderness here? Any tenderness here? Going down the back. And then coming lateral for the costovertebral tenderness. Any tenderness here? Here? Okay, and just going all the way down the back. Any tenderness down here? Okay. So now I'm just going to come anterior as well. Any tenderness? Tenderness here? Alrighty. So now I'm just going to test for respiratory symmetry and expansion with by placing my hands anterior and posterior for diaphragmatic excursion. So we'll do anterior first. So could you just take a deep breath for me? Okay. I'm gonna go into the back. Pushing in here, deep breath for me. Alrighty. Alrighty, so now I will test for tactile fremitus. I will do that anterior and posterior. So we'll do anterior first. Right, can you say 99 for me?
99.
Again?
99. 99. 99. 99. 99. 99. 99.
Okay, I'm just going to say
99.
okay.
99.
Get you to kind of lift your arms up.
99. 99. 99. 99.
Okay, now I'm going to come to your back. Come around this way a little bit to see. Okay.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, and upon doing this, we would just assess for symmetry. Alrighty. So next, I will be performing percussion, and I'll percuss anterior and posterior. So we'll do anterior first. We'll go to the back. Alrighty, and I'm just going to put this up here as well. Can I get you to lift your arms for me? Okay. Alrighty, and then upon percussing of the lungs, it should be timpani is what you should hear. So we will now, I'm now going to take a listen. First I'm just going to get you to take another deep breath for me. So upon doing that, can you do it with your mouth open? Okay, so doing that, we're just going to be listening for any adventitious sounds, any wheezing or stridor. and we didn't hear any. And now I'm going to listen at all lung fields. Alrighty. And we'll start anterior. You just take some deep breaths for me. Alright, just listen up here. Deep breath. Can I get you to lift your arms for me? Alright, deep breath. Alright, now I'm going to go to the back. Deep breaths for me. Alrighty. So next I'll be performing the egophony test. So as I'm auscultating, I'm going to have the patient say E and listening to see if it sounds like A, or to assess if it's abnormal. So we'll do that first. Alrighty. So as I'm listening, I'm just going to have you go E. Go ahead.
E.
Keep going. And then we would assess all lung fields, posterior and anterior. So now I'll be performing bronchophony. So during this, I'm going to have him say football as I'm auscultating his lung sounds. And then with that, it should sound muffled. If it's loud and clear, then that would mean it's abnormal. Okay. So now as you feel my stethoscope, I'm going to get you to say football, okay?
Football. 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 Football.
Okay. And it was muffled, which is normal. So now we'll do the whisper test. So I'll get him to whisper 99 as I'm listening to his lung sounds. And with that, it should sound muffled as well. And if it's loud and clear, then that means that it's abnormal. All right. The same thing. I'm just going to get you to whisper 99. Okay. And it was muffled, which means that it is normal. Going back to the diaphragmatic excursion, upon doing that, you would also measure for diaphragmatic excursion. So with that, we would percuss here the diaphragm and just measuring the placement of it here. So you would make a pin mark and then coming back again and measuring. So with that, the normal height of inspiration compared to expiration, and excuse me, while during that, you would get the patient to take a deep breath and hold. So I'm going to get you to do that as you percuss, and then you would measure the placement of the diaphragm. Alrighty, and breathe now. Take a couple deep breaths, irregular breaths for me, and then percussing again. You'd have the patient breathe in and hold. Alrighty, and then you would make your marks there, and with that, the normal is 3.5 to 5 centimeters. Alrighty, and that has concluded our examination.